morning. Welcome back. It's Watching Daybreak on this 2nd day of April 2024. And to introduce the panelists here in studio, we have Geoffrey Wandeto, Member of Parliament for Tetu Constituency. Good morning.
Good morning, Sam. And
I have Dr. James Nyoro, agricultural expert, but also former Governor Kiambu County. Good morning.
Morning, Sam.
And it's good to see both of you here. Happy Easter.
Thank you. Happy Easter to you too.
And Dr. John Mutunga will be joining us shortly. He will be joining from Dubai, and specifically to talk about the question of subsidized fertilizer. But before then, looking at the papers this morning, Ruto's big silence as healthcare system collapses is the main story on the Standard. They're talking about that President Ruto has not spoken about the ongoing crisis after dispatching his chief of staff to help end the doctors' strike. 2 weeks later, even lab technicians are about to follow clinicians and doctors in downing tools. When will the government and the unions find a common ground to save Kenyans from suffering? You see the images of the Cabinet Secretary for Health, Nakhumicha Wafula, as well as the Secretary General of KMPDU, Dr. Davjia Teller, who has become the face of that strike. On the front page of the Daily Nation, big divide over NADCO report, Kenya Kwanza team versus Azimio coalition team that are supposed to be evaluating the 2022 electoral process. And after that, they should be advising who now? I don't know who. Maybe the leadership, maybe the politicians on what should be done ahead of the next election. But there has been a challenge in court. There are some instructions or some orders that would see that implementation of the report has been held for the moment. And again, many other stories that are making headlines, including that question of succession fight could kill ODM. Raila warns is on the Standard. On the Daily Nation is Raila reads riot act amid ODM succession battle. And because it's an important issue, that is the question of health. We are now on the 20th day, if I'm not mistaken, in my count. And Geoffrey Wandeto, the patients continue to suffer across the country, waiting for a solution. Looks like it's not coming as soon as it had been expected. What are we supposed to be doing at such a time that nobody appears to be backing down?
Sam, it's a very sad situation, what we are seeing in our hospitals. And, you know, this strike now, I think, is in should be its 3rd week now.
Should be starting third week.
Third week starting.
Actually, sorry, the 3rd week is ending.
The 3rd week is ending. So it's actually in its 4th week.
Yeah.
And like you've rightly said, more and more parties to the dispute, you know, threatening to join. And this is just likely to make a bad situation worse. The challenge we have, and I think is what we need to do this morning, is to call upon all the affected parties. And here is the Doctors' Union on one side, and the Health and Labour Ministry on the other, because this is a labour dispute. It's not necessarily a health dispute. So the Cabinet Secretary, you know, in charge of Labour, the Cabinet Secretary in charge of Health, must, you know, do what it takes this week to see that we cannot continue with the current situation as it is, Sam, because it is the ordinary citizens that are suffering. It's the people who cannot afford public services. The well-to-do are still able to access the private hospitals, but it is the poor people out there in the village, you know, who rely on these government services and you know, who are affected. So I call upon the parties involved. We are happy, Sam, to see what happened last week, you know, with none other than the head of the civil service coming, you know, and to lead the mediation. And I think that effort should continue. Most of these are, you know, collective bargaining agreements and some of these things that these people are asking or these people are, you know, are putting on the table. They are not necessarily the easiest of things to solve. Some of them require budgetary support. Some of them require even legal, you know, issues. Like I know issues have been raised about, you know, whether interns are indeed, you know, employees or not. So there are a lot of legal, you know, and budgetary issues that come into play. And I think it's important that the parties find what I would call middle ground. If everyone takes a high position, no one backs down, at the end of the day, it's the common mwananchi that suffers. So the doctors will have let down their patients. You know, the people in government will have let down the same patients that we all, you know, say that we are supporting.
Just curious, Yes, because the government says that it has many priorities and it has challenges with resources that would go into implementing some of these agreements that are as old as 7 years.
Yeah.
But the doctors are saying, I mean, you owe it to them because there was a commitment when the collective bargaining agreements were signed those many years ago. Is there a place where Parliament comes in to facilitate breaking this standoff, or it's a question of just waiting and seeing what the executive is able to do with the unions?
I think Parliament, the major role of Parliament in this case would be budgetary support if required, and that comes either through the main budget or the supplementary budgets. Because if the ministry does not have enough resources to be able to, to meet what the doctors have requested for, then that should be put in the budget at the right time. But if you are saying this is a 7-year-old agreement, I think there is also a failure of the people who entered into these agreements, not seeing them through. And I think it's something we keep seeing, where a collective bargaining agreement either collapses in year 1 or year 2 of whatever progressive increases that have been agreed on. So it is very, very important that once these documents are agreed on and signed, that all parties to the agreement basically ensure that they follow suit. Because right now, maybe what we are dealing with is a current government finding itself with something that should have been done, which is now 4 or 5 years behind, and maybe now the increments that are being requested, since we are dealing with a backlog, cannot, practically be accommodated within the existing budget. So, if once these people agree and some budgetary support is required, I think that should come to Parliament in the very normal way. If there is any change of law that is required to basically be able to accommodate this whole internship issue, again, that can come to Parliament through the Health Committee. But it is very, very important that we resolve this issue ASAP.
Yet, Dr. Nyoro, you once served as governor of a county. This question of especially employment of doctors, it would more or less be basically a question of the counties, because many of the hospitals, that's where they're destined, or they're domiciled rather. So what is it that counties can do? Because I've seen a few of the governors saying that they're going to fire the striking doctors. If you need your job, come back to work. But then the ministry at the national level is saying this is a county function. It is them that should be dealing with this. But the reality is that patients are now struggling into almost the 4th week now. What do you think county governors especially should be doing at this time?
Thank you, Sam. I think it's a very unfortunate situation that we are in. And I want to agree with Geoffrey here that the different parties must stop digging deeper. Mm-hmm. By the day before yesterday, midnight, hearing that the clinical officers have downed their tools, mm-hmm. and then we hear about laboratory technicians, we hear about nurses. It does not make this situation any better. And, yesterday you carried a situation in one of the hospitals in Kiambu, mm-hmm. Where a lady was going to, for maternity, actually, to be admitted to go through cesarean section, and she was wondering, where should I go? So it's a very, very sad situation, and I think the way forward is for both parties to sit, to stop digging deeper, sit more frequently, and appreciate that the head of public service had a meeting when they need to meet to meet much more frequently, and each one of them should know that there is no winner takes it all situation. It has to be a win-win situation. The 19 issues that the doctors are raising, maybe they can do 10, they can promise a 7. Mm-hmm. There has to be a roundtable discussion. Otherwise, then we are digging deeper, and by the end of this week, the situation will be very bad. You asked me a question. We also had a problem. Yep. If you can remember, during COVID, that is when the doctors really were supreme, because there was no way you could have allowed the doctors to go on strike one day. The numbers that were being read every day of COVID cases, particularly in Nairobi and Kiambu, were so high that if there were no doctors for just 1 second, you probably would have seen the impact. The thing is, within the counties, there are doctors who belong to KMDP, PDU. Mm-hmm. Those are the members. The others who are not members, those ones are engaged directly by the county, either through locum or through contracts and others. So the ones that are not members of KMPDU
is fine.
Yeah. The ones who are not members, those ones you can talk to. But the ones who are members, I can tell you, I had to have a number of meetings with the chair in Kiambu to plead with him and argue over certain issues that were completely beyond my control. If you look at the CBA that you are talking about, as governors, they were not involved in negotiation of the CBA. And yet, they are supposed to be implementing the CBA. So part of the reason why you are having health, unlike other sectors, having the kind of problems that we are having, are two in nature. And we saw it. We learned through the COVID period that there was a lot of consultation. If you can remember, the president, the 50th president was holding a summit almost every 2 weeks with governors, with the Ministry of Health, and there were consultations and plans that were done. The first thing in consultation, there isn't much consultation that we are seeing right now between COG and the ministry. What we hear is that more and more money is going to the health ministry instead of that money going to the counties.
Right.
Now, the other thing is to delineate the responsibilities. We had a problem, Sam, and I think it's one of the 19 issues that the doctors are raising on who should take up the training of doctors. So a doctor has been posted in Kiambu, and then the doctor decides to go and do a postgraduate degree, a master's in gynecology. So what do? This doctor goes. The doctor is under your pay as a county. He's not providing service to the county. Once he's through with his training, he will be posted to another county. So why should my county be the one paying for that doctor? And we sat down, we had a roundtable discussion, and we agreed that the national government should take up the training of doctors so that at least once that postgraduate student leaves, we can hire another person. So all I'm saying, two things. One, there has to be a roundtable discussion immediately.
Right.
People should stop digging deeper. Two, there has to be more coordination. The ministry is not superior to the Council of Governors. They have to sit because health at the stage 4 is devolved. And the third thing is that resources towards the Ministry of Health must be increased in accordance to Abuja Declaration of the 15%. We need to have more doctors, more farm and more non-farm going to the hospitals.
Just out of curiosity on what you said about raising the allocation to 15% to the Ministry of Health, yet health is devolved. How do you ensure that is also cascaded to the counties themselves? Because even if you have to allocate resources for the National Ministry of Health, then it doesn't help. What is needed?
No, there's something that the president said when he came in. And I don't know whether the members of parliament or the government is following. Yeah. And the president said that all the unbundled functions, all the functions that otherwise are being undertaken by the national government, which are functions at Schedule 4, they are supposed to be undertaken by county government, needs to be listed out and they need to be devolved to the county. We normally say that once you devolve with the money. Yeah. So in terms of adding money, it's really a question of delineating what role belongs to the national government and how much does it cost. Right. And what role belongs to the county government and how much does it cost. There has been this issue, and doctors will tell you, and sometimes we don't see it the same way, particularly the counties. I don't know why I'm saying we, and I am no longer. It's about whether there should be a health commission. Yeah. They look at Teacher Service Commission. They look at the National Police Commission. They look at those commissions, Public Service Commission. They look at those commissions and they say these ones are looking at particular issues and relate to Revenue Allocation Committee or other bodies.
Yeah.
There has been that issue. The counties are not very happy about it because they feel like that is taking the health function away from the counties. But at the same time, the lacuna that there is between the counties and the ministry needs to be filled in by probably a professional organization like the Health Commission.
Okay, interesting. But of course, now we understand that the clinical officers are on with their strike, and of course this is going to impact more heavily on what happens to the county hospitals and especially the patients and what they have to deal with. Again, Honorable Ondeto, there's that question of NADCO reports. A court order was given last week, or directive, that the NADCO report should not be implemented until that matter is heard and determined. Again, you see a bit of contestation, especially from the Azimio side, saying that Kenya Kwanza wants to kill this report, but also to reconstitute IEBC without the involvement of Azimio. So what does Kenya Kwanza want in this?
Well, I've also some read in the papers that Azimio is claiming that Kenya Kwanza wants to derail the NADCO process through the courts. And I'm not aware of any official court process that have been initiated by Kenya Kwanza to stop NADCO. So I think this is speculation. I think what we have here is a citizen who has gone to court, which is a right of every citizen in this country to petition the court over any matter. The court has given an injunction or some temporary orders. But I think since that's an active matter in court and whose outcome we have to wait, let me just state that the Kenya Kwanza government is very, very committed to the NADCO report. And I think this can be shown by the activities that you've seen in the last few months since the report was concluded. The Kenya Kwanza has also appointed a three-member team to discuss basically the issues around the elections. So has Azimio. And this is basically the process that maybe has been stopped by the court. But we are very, very committed to the implementation of the NADCO. Remember, the NADCO report was an initiative, a joint initiative between Kenya Kwanza and Azimio government. You saw the president receiving the report. Yep. The president has himself committed, to the implementation of the report. The team leader on the Kenya Kwanza side, the majority leader, has time and again emphasized the commitment to the report. And it's important to not just deal with NADCO, just as a report, but we must also remember where we are coming from and what we are trying to cure through NADCO. These issues are very, very important, and we would want that as we come to the next election in 2027, we do not have, this perennial contestation of results. If we can resolve that once and for all as a country, I think we'll have made a significant, step forward. We have, as government, we have tried as much to accommodate most of the issues that were raised by Kenya Kwanza, even when most of those issues were difficult issues. And it is important that we do this for the country, because the country is bigger than any one political party. The country is bigger than any one individual. So we are committed as Kenya Kwanza on our side to ensure that there is full implementation of this report.
We are committed, you say. Dr. Nyoro, I know you are no longer active in such matters, but what are you taking from this discussion? Because it's not the first time that way after an election we are coming together to talk about such, and claims of commitment or non-commitment. They are now here, Azimio claiming that Kenya Kwanza is not committed to the implementation of the NADCO report. What should we be doing with this information at such a time?
Well, I think the fact that the court has made an injunction on the implementation, and when you read deeper and understand what is being stopped, then no wonder you can probably try and see who went to court or not, who did not go to court. I think really for me is to say that it is unfortunate for this country to dilly-dally the way we are dilly-dallying on aspects such as the the formulation of the electoral what do you call it? The electoral commission. Mm-hmm. I think for sure there's need for an electoral commission right now. I think we have seen two mistakes that we have done in the last two terms, where we come late and formulate an electoral commission that sometimes is contested, and instead of that commission preparing for the election 2027. We only have 2025 and 2026 now. Instead of them preparing for that election, there is contestation on whether this should be there. I think for me, the first thing is when you look at democracy, democracy is not always looked at with a back lens. We should look at democracy with the front lens. Yeah. And therefore, I think it will be important that some of these issues that are going on, stopping the implementation of some of very, very important components within NADCO be sorted out. I think the other one is to have a goodwill. In all of this, and I know in politics there's nothing like goodwill. It's really who can run faster than the other. But I think in a situation like this, which came in because people lost their lives and there were a lot of issues to do with the country coming to a standstill and so on, it is important for either of the party to at least consult and say which direction they are going. I think, for me, I have not given up on NADCO report. I think the most important thing is we have to run some of the mistakes that we have committed over the last so many years, so that at least 2027, we can have an election like no other. Secondly, I think it is important that we have an electoral commission that sits from today, so that they can audit what has been done. They can also conduct elections in areas that needs to be done, and also prepare for 2027. I think these others would use what you would call the sideshows, and but politics is all about sideshows.
Okay. All right. And we will leave that question there because we need to take a short break. When we come back, we'll be diving into the conversation about the concerns that farmers have raised in different parts of the country, especially in Trans Nzoia County, but also parts of Western and Nyanza region, saying that they are receiving some fake fertilizer. Who's telling the truth? Dr. James Nyaru will be helping us to understand what exactly do you need for your soil, and what should your fertilizer look like? Because you may not have a laboratory to go test it, but how should it look like? We'll talk about that after the break.